I'd like to welcome everyone to our electronic council meeting on June 30th, 2021. Due to the COVID-19 pandemic, Regional Council is practicing physical distancing and I am present in the chambers. All other members are participating electronically. I would like to acknowledge the land on which we gather virtually today is a traditional territory of the Haudenosaunee, Anishinaabe, and Neutral people. We acknowledge the enduring presence of the Indigenous people with whom we share this land today, their achievements, and their contributions. Tomorrow is Canada Day. Residents across the region will prepare to celebrate and reflect on our country. It is important to remember that Canada Day is not about fireworks, but about people. Whether you choose to celebrate or to pause and reflect, or both, your decision is respected. Canada Day is an opportune time for listening to what Canada Day means to your neighbors, your community, and your friends. Only in coming together, acknowledging the past and the truth, and supporting and respecting one another can we move forward with hope for our future, a shared hope. I would now ask Tim Brubaker to conduct the roll call.
Thank you. Councillor Armstrong?
Present.
Councillor Clark?
Present.
Councillor Erb?
Present.
Councillor Foxton?
Present.
Councillor Galloway?
Present.
Councillor Harris?
Yeah, present.
Councillor Jaworski?
Present, but I need to reset my internet.
Okay. Councillor Jowett?
Present, but I need to reset my internet.
Okay, thank you. Councillor Jowett?
I'm here.
Councillor Kiefer?
Here.
Councillor Lawrence? He's not. Councillor McGarry?
Present.
Councillor Nowak?
Present.
Councillor Shantz?
Present.
Councillor Strickland? Councillor Strickland? No. And Councillor Vrbanovic?
Present.
And Chair Redmond?
Present.
So that's all present except for Councillors Lawrence and Strickland.
Thank you very much, Tim. Declarations of pecuniary interests under the Municipal Conflict of Interest Act. Councillor Jowett.
I'm just so eager, Chair Redmond, to probably do what's maybe the final declaration on this conflict of interest. It's under the addendum agenda for today, under the minutes of the previous item C works, the public input of the regional official plan from June the 10th of this year, and as enacted in the first, second, and third readings, item D.
Thank you,
Councillor. Direct pecuniary interest. Thank you.
Thank you, Councillor Jowett. Councillor Shantz.
Thank you. Mine is also coming out of the Committee of the Whole, and it is the new affordable rental housing CSD-HOU-21-12/COR-TRY-21-53P 2021-05. It's new affordable rental housing, and my husband is consulting with Spruce Lawn Apartments on there.
Thank you, Councillor Shantz. Councillor Harris.
Yeah, I too would like to declare a conflict of interest on the subject matter new affordable housing, the same report number CSD-HOU 21-12, item number 12, as due to my employment with Vandal Construction.
Thank you, Councillor Harris. Councillor Jowett, is that a legacy hand or do you want to make another comment?
That is a legacy hand. I apologize.
Not a problem. Thank you. Colleagues, we are now going to have a COVID-19 update. We have both Dr. Wong and Deputy Chief Hilton to provide updates on the pandemic as well as the vaccine rollout. And I believe Dr. Wong is going first. So welcome, Dr. Wong. You have the floor.
Thank you, Chair Redmond. Good afternoon, councillors. So today I don't have a slide deck. I will have a verbal update. So I'd like to start with some highlights about the update. that I'm going to give. The Delta variant is the greatest adversary our community has faced during this pandemic. It is the most transmissible and aggressive variant we have experienced. Without public health measures and vaccination to control spread, on average, Delta quickly moves from 1 person to 6 to 36 to 216 to 1,296. This is how aggressive Delta is. It will take some time for the spread to slow. The good news is the vaccine rollout is working. Almost 80% of residents have had a first dose, more than 30% a second dose. As we continue to make it easier for residents to get vaccinated, we are building a stronger wall of defense against the Delta variant. The next couple of weeks are critical. Thank you to our community for stepping up together to get through this. We need to stay the course with our plan. I have issued instructions under the Reopening Act for Waterloo Region, posted on our website, to stay in step 1 for approximately a couple of weeks longer. This is a strategic decision to provide us the best chance to reopen and stay open. Where are we seeing Delta? The Delta variant is prevalent throughout the region and is not limited to one demographic. We are also seeing rising infection rates in the younger age groups, including those under 20. Over the last month, close contact transmission has been the most frequent type of transmission, accounting for more than half of all cases locally. This means the variant is spread through close contact with friends, co-workers, family, neighbors, etc. Over the last month, all outbreak-related cases accounted for a small percentage, approximately 13% of all cases. Delta continues to mostly impact those who are unvaccinated. What can residents do? They can get their vaccine and encourage others to do the same. And if they have any symptoms, even mild ones, to please self-isolate and get tested at a testing center. If you have any symptoms, self-isolate. This protects your friends, family, and community. Please remember that rapid tests cannot be used if you are experiencing symptoms or have been identified as a high-risk contact. Rapid tests are designed to be used for frequent, regular, symptomatic testing as part of workplace safety programs, as a complement to, not a replacement for, the regular test. In closing, I am grateful for everyone in the community who is working together to rapidly ramp up vaccination efforts. It truly is a team effort. Our local hospitals, primary care providers, pharmacies, and a multitude of staff and volunteers are all working together to ramp up to meet the demand locally. A very special thanks to all our residents who have stepped up to get vaccinated and who have helped others get vaccinated. You are not only building that wall of protection for yourselves and for your loved ones, but also for Waterloo Region as a whole. This community is rallying together in our time of need. The fight against Delta is a difficult one at the end of a very long road, but we will overcome this. Again, the good news is the vaccine rollout is working. And as we continue to make it easier for residents to get vaccinated, we will get through this together. I wish to thank this community so much for their patience, their kindness, and for protecting one another. Thank you.
So colleagues, I'm going to go to Deputy Chief Hilton, and then I will come to Councillors Foxton, Clark, and Chauncey. You already have your hands up. Deputy Chief, for the vaccine rollout update, you have the floor.
Good afternoon, and thank you, Chair Redmond. To begin, I wish to highlight that we have achieved our mission. The commitment was all residents of Waterloo Region who wanted to get a COVID vaccine could have their first dose by June. This has been achieved. Vaccine rollout, as you've heard, is working. Almost 80% of 18+ Waterloo Region residents have received 1 dose, and more than 30% a second dose. 1 month ago, we were administering 30,000 doses a week. We have doubled that to 65,000 doses a week and striving for more as we continue to ramp up. Over the last 7 days, we have averaged 9,000 doses a day. We are making it easier for residents to get vaccinated by initiating the self-booking system, providing new clinic offerings, increasing capacity clinics, and expanding hours. And because the public has been so responsive to walk-in spots for first doses, beginning tomorrow, July 1st, first dose walk-ins are welcome anytime at any of the regional clinics, including the pop-ups. We are committed to providing more opportunity for residents to receive first and second doses. I am pleased to announce a vaccine event this weekend, hosted by and in partnership with Binghamton's. More information will be released closer to the event. And many community partners are working together to get vaccines into arms as quickly as possible. In addition to the public vaccination clinics, residents can also get their vaccine at one of the 123 pharmacies in the region, as well as many primary care and family practices. I would like to take a moment to express my sincere thank you to the community for making vaccinations a priority. Thank you.
Thank you, Deputy Chief Hilton. And I'll go to questions and comments. Councillor Foxton.
Thank you, and through the chair. Ladies, thank you very much. This has been an ugly time for you. You have taken the weight and responsibility of all the people in Waterloo Region and worked your utmost to ensure that they are taken care of, even when they don't want to be taken care of. And we have asked you tough questions, and we've put you in tough situations on our council, and that's our job, is to add the tough questions that our people are asking us. And so I think we've done our job, but I know that the weight has been heavy upon you. So there's a few things I want to clarify. For the people out there in the public, this is done to save lives, bottom line, very bottom line. And every life saved should be cheered. This is not just to make your life more difficult. This is for the safety. And now it's hitting the youth. Number 2 that I want to strongly state, this was not caused by people who are homeless. In fact, they're a very small percentage. And anybody spreading this gossip, please stop. The facts are on the website of the region. Look them up. You can look at the neighborhoods and see where the problems are. But let's stop pointing fingers and do the right thing. Deputy Hilton has gone far beyond in offering more and more clinics, more availabilities, walk-ins for those who have never been vaccinated. Take advantage. These people are doing all they can for us. And if it's extended 2 weeks, we can suck up 2 weeks if it saves even just one life. So ladies, thank you. And I know this has been hard on you, and I'm sorry for that. But we're going to get through this. We're going to be stronger. And the majority of the population appreciate what you're doing. So thank you.
Thank you, Councillor Foxton. We'll now go to Councillor Clark.
Thank you, Chair Edmund. And thank you, both of you, for the presentations. Some really good news in there. I want to agree with a lot of what Councillor Foxton said, and there's really 2 comments that I would like to make. And one is to thank Dr. Wong for highlighting that only 13% of our cases are associated with outbreaks. I think that there's a concern that the media talks a lot about the outbreaks, and I think it's because it's a big, dramatic, and exciting word. But I think it creates 2 problems. And one is that it creates blaming of the locations and and the groups that are experiencing the outbreaks, but also it creates in people a false expectation that if they only avoid those places or those people, they'll be safe. But we've just heard that 87% of our cases are not associated with any outbreaks. So I think that's a really important number for everyone to hear, and I hope the media will talk more about that. My only other comment, and I'll make it really quickly, is with regards to the outbreaks that have been in the homeless population. I really want to acknowledge the work of public health and all of the public health partners in combating that really quite terrible outbreak. I don't know the status today, but as of yesterday, there were only 12 active cases remaining. And that's because those people have been out every single day, weekends included, in the shelters, in the food programs, in the drop-in programs, doing the testing, doing the vaccinations, providing the resources, providing the supports, making sure that isolation happens. And I just think the efforts there have been really heroic and very successful, because we know that we've had well over 100 people in that population affected, and we have a small number of people that are still ill.
Thank you, Councillor Clark, and thank you for driving down to that level of detail, because I know because of your day job that you're intimately aware of that. And I don't think that everybody in the community knows how amazing those outreach workers and the public health workers are in making sure that with our partners in the community, we're supporting the unsheltered. So thank you for providing that level of detail. Councillor Schatz.
Thank you. I wanted to say thank you also to Dr. Wong, Deputy Hilton, Lee Fairclough, Dr. Ball, the whole team for all the work that you've done. You know, people are frustrated and upset, and they're looking for someone to blame, but you aren't someone to blame, and you know, I hope you don't take it personally. If people want to blame someone, I think, or something, I think they should blame the virus. But honestly, it's only doing what viruses do. It's trying to survive. And when we don't follow the public health guidelines, we allow it to survive and to mutate and to get stronger. So what you're doing for us is helping us to know how to stop this virus from continuing to survive. And so just encourage everyone, you know, our best defense is the vaccine. We're getting lots of vaccines now, and Deputy Hilton and her team are doing a great job of getting them in arms. So please, you know, if you haven't had one, walk in somewhere and get one. And if you need your second dose, I know there are some frustrations sometimes too with scheduling that second dose, but stick with it and get it done, and we will beat this.
Thank you, Councillor Schatz. Councillor Jowett.
Thanks, Chair Redmond. And just a couple of quick points. I've had a couple of people say the discrepancies between the province and us, and I try to tell them that that's a timing thing. So as long as you guys are reconciling that on a larger scale, I'm sure that's all coming out in the wash. And you're right, there's a lot of human emotion around this particular challenge when it comes to the lockdown. But one of the things that I felt you said, Dr. Wong, resonated heavily that I think will help us put it in perspective. During the first wave, the transmission rate was not, and if memory serves me correctly, when I used to study exponential math, when you say one person, you know, infects 6 people, and then 6 people infect 36, it reminds us really clearly that during the first wave, that was not the case. And that is why the community outbreak is so significant, and that is why it is so vastly penetrating the entire community. And I think that's what people have to put in perspective, is that it's a lot different now, the infection and the way it is percolating and permeating the entire community. And I hope folks just kind of keep that in mind, because it's looking pretty different.
Dr. Wong, did you want to respond?
Sorry. Correct, Councillor Jowett. The reason the numbers are different is because they're pulled at different times. So when the province says yesterday health units had these number of cases, they end yesterday at 2 p.m. And so they pull the 24-hour period that goes into the day before as well. Whereas our numbers have always pulled the entire 24 hours of yesterday. So midnight to midnight. So it's a more up-to-date total for the previous day. That said, the numbers end up in terms of the total number after a week and the average, it ends up being the same. You know, our rates and the provincial rates end up matching after you know, after being reconciled. The other thing is you're also absolutely correct that the Delta variant is the most transmissible. So whereas before the original variant, you know, one case would give 2 naturally, this variant, one case will give 6, and then 6 will give 36, and 36 will give 216, and on. So it is the most aggressive variant that we have seen to date in this pandemic, and that is why it is more difficult to control, and why it will take some more time. But we can control it. We do know that the vaccine still works against this variant, and the more that we increase vaccination coverage in our community, the more that will put downward pressure on Delta as we go along.
Thank you. Councillor Vrbanovic.
Thanks very much, Chair Redmond, and thanks both Dr. Wong and Deputy Hilton for your updates and for all of your ongoing work. I'm sure in many ways you feel the weight of the world is on, or at least the weight of Waterloo Region is on your shoulders. Dr. Wong, it did, you know, obviously you had to make a very difficult decision with respect to the whole issue of phase 1 in Waterloo Region. And it's one that I know you wouldn't have taken lightly and would have grappled with based on the powers that the province of Ontario have given medical officers of health in their respective jurisdictions. But I know one of the questions, though, that I keep getting is people struggling between sort of the Delta variant and, you know, issues and concerns around mental health and well-being and the impacts of that on people. And I'm just wondering if you can talk a little bit, because I know that, you know, this meeting is being covered. I think it's important that people understand, you know, how you weighed and balanced those issues out in terms of making the decision that you did. So I'm wondering if you can, you know, maybe help people understand that.
Thank you for the question. I completely understand that after a very long period, you know, under restrictions and, you know, with people not being able to do as much as they'd like and businesses not being able to open, this has been extremely hard on people. And I do take into account, you know, the balance of risks. And I've made my decision with the strong support of Ontario's new Chief Medical Officer and the healthcare system leadership in our region, including all hospital CEOs. And given where we at and where we, you know, continue to be at, although now we're seeing some signs of stabilization, a move to step 2 would have very significantly increased societal contacts. And the science table has said that that would create a significant risk of a Delta surge. Well, here we already had a Delta surge, so that would have been even worse in terms of risk. And so the decision that I made, I understood that it meant that, you know, for approximately a couple of weeks, people wouldn't be able to do the things in step 2. But I weighed that against more severe restrictions, for example, going back into shutdown versus, you know, not proceeding at this time on a temporary basis to step 2. And with the importance of trying to prevent things from getting worse, because we see how quickly Delta can, you know, explode. The decision was made to do everything possible to allow us to control Delta while allowing us to continue with the things that we're able to do right now. So there are things that, you know, our residents are still able to do, like, you know, for example, children can go outdoors and play sports and have sports activities, but they can't do the organized team sport activities that are part of step 2. And there are things that people can do, you know, in certain businesses, although they cannot do as much and as many businesses cannot open until we go to step 2. But the decision was made considering the balance of risks and what was the best way to actually allow us to continue our trajectory to reopen, because that's what we all ultimately want. But reopen in a way that is more cautious so that when we do reopen, we can stay opened. So that was my goal. And I know there are downsides to every decision. And I know it's really hard for a lot of people, and I'm truly sorry for that. I made the decision that I thought was best for the overall community and to allow us as a community to keep moving forward.
Thanks.
Thank you. Excuse me, Councillor Vrbanovic. I'm just going to interrupt just to say, unfortunately, Deputy Chief Hilton has another obligation she can't choose or cannot change. So Shirley, thank you very much. We'll allow you to disappear, and I'm sure Dr. Wong can fill in, or Mr. Lochner, vaccine questions. So thank you so much. Go ahead, Councillor Vrbanovic.
Thanks, Chair Redmond, and thanks, Dr. Wong, for that very fulsome answer. And I think that certainly helps provide some reassurance for those in the community who really want, you know, are looking to understand as best as possible what clearly was a difficult decision to make, and one that you know, you struggled with clearly by the answer that you've given. As just one follow-up to that, if I may, you know, I know where some of the major concern lies is around young people, and depending on how long this temporary extension needs to continue, is there a scenario where you might, because this is starting to roll into the second year of kids not being able to play sports in some instances, is there a set of circumstances where in fact you may amend your order and perhaps allow for you know, some of the sports that aren't permitted right now to in fact be played, depending on how long things go?
Thank you for the question. So at this time, I anticipate that it will be approximately a couple of additional weeks. And I commit to providing regular updates and when I have a specific date, to come back and update council and the public as soon as I have it. In terms of the sports question, I understand that it impacts, you know, the season in terms of the schedule, and games starting, in other areas where we're not able to participate in yet. Really, the totality of the activities that were placed in step 2, well, actually in all the steps, step 1, step 2, step 3 were, made by the government after input from expert groups on, what should be in each category. And so I am treating them as a whole. So any activities that are under group 2 will, when we move to step 2, will all be permitted to begin as soon as we move to step 2. We do know that step 2 is a progression on step 1, and there are more instances of outdoor activities that are being allowed, as well as some more indoor activities as well, but it's about the scale. So yes, outdoor activities are less risky than indoor activities, but step 2 is about the scale. And when you move from one step to the other, you significantly increase on a whole community contacts. And so that's why, when we move from one step to the other, we're going to do it as a whole and not by different categories, having certain activities be exempted. Or I do think, that overall isn't the right approach, because there are many outdoor activities, for instance, in step 2, but it's about the scale of all the activities together. And because I am looking at a temporary, approximately at this time, 2 weeks, that's also another reason that, I'm not considering going into the different, lists of activities and trying to subdivide further. Because these were groups that were determined, by provincial experts and at the provincial level, and so I think it's simpler to keep it that way. And obviously, watching closely, and as soon as we can move into step 2, I would tell the community with as much advance notice as possible. And then I would lift it as soon as I could.
Okay, great. Well, thank you for both of those answers. And just on a side note to both you and Deputy Hilton and the rest of the vaccine task force team, it was great to see the energy on Friday night at the Shots After Dark event, and encouraged about news of this weekend's event at Bingham's, and hoping we can see some more large scale events like that in the weeks ahead. And I'll just say that certainly from a City of Kitchener point of view, we continue to be ready to support you in terms of using any of our facilities if you find that they would be beneficial for the work that you're doing.
Absolutely. And I know you've already supported us with vaccination clinics, and we really appreciate it, Councillor Vrbanovic.
Thanks, Dr. Wang.
Thank you. Councillor Harris.
Well, thank you, Dr. Wang, and of course to your team and Deputy Hilton's team. Look, I'm glad you further explained the Delta here in our region and why obviously you've had to make the difficult choice of keeping us in step 1. No doubt I sympathize with many of the folks within our region that are obviously extremely frustrated about that, who have by and large done their part to go and get vaccinated, not once, but twice. And we're hopeful that when we hit those numbers, we would be then allowed to enter step 2. So I definitely sympathize with those people. I don't, unfortunately, sympathize with those that have not opted to get their first or second vaccine yet. that is a continuous frustration, I'm sure, with the entire. I'm wondering if you can share with council today, anybody on the line here, I guess, the resources that we need to continue to further vaccinate our community, knowing that we are in a hotspot. And I've heard the province repeatedly say that they would be available to supply the resources necessary. And we know that our medical professionals here in our community are stretched, probably very thin, overworked, exhausted, you name it. I mean, I was at the clinic on Friday night at the Rona, in Cambridge, and you could see folks are tired. Obviously, we can't do this on our own. They've committed to those resources, mobile clinics, additional staff. Can you tell me, when the ask has gone out? When would the ask gone out to the province? What is the ask, and what has been the response of the ask for help here in the region? I really strongly believe that we need their support and help in order to get us across the finish line here. And something tells me that we're just not seeing the resources and support that we need. Maybe you can provide some clarity.
So I'm going to start, and then Dr. Wong can jump in and just say, Councillor Harris, the ask has been made throughout the pandemic. And when Toronto and Peel were the hot spot, 50%, I think, of all vaccine was going to the hot spot. And we didn't argue with that because we've always taken the view that every vaccine is a win, because we know until everybody's vaccinated or we have herd immunity, we are all going to be vulnerable. So I would tell you that I have not gone to the Premier or to Minister Jones or to the Ministry of Health and gotten a hard no. And recently, over the past sort of 3 weeks, when we realized that this Delta variant really had a foothold, I've been told by the Premier, and I know that Councillor Vrbanovic has talked to the Premier as well, anything we want, we can have. We have vaccine. We have every assurance that the more vaccine we need, the more we will get. And they are sending, there was a Red Cross team, I guess, that started at 99 Regina. They continued for 4 days. We have more teams coming from the province next week. It's one of the reasons why we can expand Pine Bush. And there hasn't been a no. So they have stepped up. The reality is we're probably 2 weeks behind in having enough vaccine to catch up to previous hotspots. We know we're the hotspot now. We know the Delta is in other areas of the province. And right now, we are getting a very supportive response from the province. I don't know if Mr. Lochner or Dr. Wong want to jump in.
I think you've said it well, Chair Redmond. I don't have any further comments. I don't know if Bruce has any.
Okay. So I don't know if that answers your question, Councillor Harris, but just to say that I have always received a positive response. It's sometimes not as much as we want. It's not as fast as we want. But since we've been the hot spot, I would tell you that it's been a very timely response.
Action is definitely what we need, so thank you.
It's a great question. Councillor McGarry.
Thank you, and through you, Chair Redmond, that is actually a very good response. And I just really wanted to add on that any of us heads of council that have been meeting regularly with our MPs and our MPPs in particular, we have continued to advocate at every table that we're at in order to ensure that we have the vaccine and the resources that we need, and in particular during a variant, whether we're at the big city mayor's table or we're at the AMO, wherever we've been, we've continued to assist in the advocacy department, for our region and for our area municipality. So every time there's been a request, there's certainly answering support from all of us that have the opportunity, at any opportunity, to ensure we have the resources. I did want to thank Dr. Wong and her team, as well as Deputy Hilton and her team. All you're trying to do is save lives and save health. And in order to do that, we've had to make some uncomfortable choices. And when I was on the Ontario Health Team update on Tuesday morning, we talked again about the almost the untold story, or the story that is out in the press, but people are not wanting to hear.
And that's the story of our overwhelmed healthcare departments and our hospitals. And we talked about the fact that, when the hospitals had, or our area hospitals had 25 COVID-related people in their ICUs. And there was another 20 still in the ICUs that no longer tested positive from COVID. So not only are we looking at the actual positive COVID patients, we're looking at those who are languishing in our ICUs on long-term ventilation that have actually not been able to be released from hospital. Our healthcare workers do not feel we are out of the pandemic. So when we do have people on one side wanting their children and wanting their activities to go back to normal versus our very burned out healthcare team in our hospitals, I think you've made the decision that you needed to make in order to preserve the health and welfare, not only of those that are unvaccinated or not immunized long enough yet to have the benefit from that immunization to be immune to this variant, but you're trying to protect the health and welfare of everybody. And I think that that's admirable. And we need to keep that uppermost in our mind. The one thing that strikes me just from people that are reaching out, people that are calling, online kind of posting, they think that once they have their shot, they're that 80 to 90% immune to this variant, when in fact, at one time, having had just a first immunization provided far more protection than just one shot does against this Delta variant. Dr. Wong, could you just explain very quickly again what percentages have changed in the immunization efficacy or efficiency after just one dose with the Delta variant?
Dr.
Thank
Wong?
you for that question. Yes, it depends. The numbers will depend on the outcome you're looking for. So if it is having a symptomatic infection, which can be mild and is generally milder in those who have been vaccinated, you're looking at only 30% effectiveness after a first dose. And that rises to 70% or more after a second dose. However, if you're looking at the outcome of serious consequences such as hospitalization or passing away, then all vaccines that have been approved in Canada are quite effective. So after one dose, 70%, and at least sometimes more, and then with 2 doses in the 90s. So, and this is against Delta. So the vaccines are still very effective against Delta, but you're absolutely right. It's different than with the other variants that came before it. Even the Alpha variant, which used to be just a couple of months ago our dominant variant. With that, you saw higher rates of efficacy after one dose of the vaccine. Now you see lower rates of efficacy after one dose with Delta. So it's exactly as you said. With Delta, we have to be more cautious because it's not as effective after one dose, although it is still quite effective for serious outcomes after one dose. But in terms of getting infected and potentially spreading it to others, is not as effective. So that is why, and it's been our, like I mentioned earlier, our greatest adversary to date, because of the spread, because of the fact that it isn't as effective right away, or at least with one dose, and so that's why it's important to, be even more diligent with the precautions and with the vaccine rollout. I mean, more aggressive with the. Sorry,
Councillor
I'm a little
McGarry?
tired today. You know what I mean. It's more important to get the vaccine out, second doses out, and to keep up with our precautions in the meantime.
Thank you. And if I may, Chair Redmond, I did want to thank you. It was a wonderful event for all of us to go to at Shot in the Dark at the Pine Bush Clinic in Cambridge last Friday night. And I have to say that with the number of hours that you must put in and day out, that are countless, and that goes on even when you're allegedly on holiday or trying to rest, to see you there to help to volunteer that night was really inspiring, not just for us as regional councillors who were there to also volunteer, but certainly I heard that from many people that were doing the vaccination and the other volunteers. It was a real boost to see you there doing what you can, even though you do more than probably most of us during this pandemic. So again, my thanks. And the last thing I am going to say is that the booking system has worked as it's needed. It's frustrating sometimes to get the appointment as possible. And I encourage people to keep checking and also to check in with the pharmacies as well. The update was just as I was getting ready yesterday for my own council last evening, we had a sudden call from Pine Bush Clinic, and both our last two sons that needed their second dose were there 20 minutes later, courtesy of my husband, right in the middle of the storm. So our whole, at least immediate family is vaccinated. And I can't tell you how important that is to not only our family, but our broader community. So thanks again for everybody's efforts.
And Councillor McGarry, if I could just make an observation, as stressed and overworked as all the people are that are volunteering in the pharmacy techs and the nurses and the doctors that are staffing along with the volunteers, whether it's Pine Bush or Boardwalk or the School of Pharmacy or the pop-ups, no single group is more excited that we have more vaccine and looking for special events. And Vicki Murray is the person who is our operational pinpoint or point person right now. And she comes back and goes, I told them they'd have to work these long hours and they're all really jazzed and they want to. So this is a group that has such commitment to our community. And it's great to help when you can. So thank you to all council members that were able to be there. I think it's Doses After Dark. I think we decided that Shots After Dark sounded like the last call at a bar, so we changed the name. Councillor Shantz.
Thank you. To Dr. Wong, yeah, I've had a couple, I'm just trying to think of the right way to word this. There have been a couple of high profile cases in the community, and it's causing some concern. So I guess when I go on the website and look at the distribution, I would say our distribution of vaccine is similar to the rest of the region. Is there any chance, though, of a pop-up clinic coming to the north end of the region at all? Do we have to wait for more provincial people to come for that, or?
No, thank you for the question. So the pop-up needs are assessed on a weekly basis by a team on the vaccine task force, and they look at things like rates of vaccination in a certain neighborhood, as well as what we call test positivity rates, and they also, though, really work closely with the community partners that provide service in those communities and that are closest to the people that we want to reach, because they have the best insights for the vaccine team on what is actually needed. So there's actually some circumstances where the response has been, we don't want to pop up. We want this through our family doctor. We want this through the clinic that we normally go to. We want this through, that kind of thing. So we try and tailor it to what the community, through their leaders, the people that serve them best, are telling us what is needed. I can say that in your township, that work is ongoing with the Ontario health teams, which have this as part of their mandate. and they work obviously very closely with the vaccine team to try to plan for the most appropriate service for that community at that time. So that there's ongoing work on that, and I know it continues today.
Councillor
Thank
Schatz?
you. Yeah, thank you for that assurance. Sometimes it feels like we're sort of getting left out up here, and so I appreciate the assurance that we are being taken care of, even if we don't see a pop-up clinic.
Mm-hmm.
Thank you. I'd just like to talk about dedication. Deputy Chief Hilton is back on. If you have any more questions specifically for her, thank you for coming back. Councillor Galloway.
Thank you, Madam Chair. Well, some of this might be for Deputy Hilton, so Dr. Wong, Deputy Hilton can divide it accordingly. First of all, I just did want to say to both of you, particularly now that Deputy Hilton's back, the thanks that I have and others that have expressed to me as well for the work under very, very difficult circumstances. There's just so many epidemiologists in the community right now, and who all seem to know just a little bit better and than the experts, and of course they all have a right to their opinion, but it does make things somewhat difficult. So it's been horrendously difficult for all you people to be able to do this work for the betterment of the community. And I particularly want to support the notion, and I know we don't get to approve your decisions, and I'm glad for that, Dr. Wong, to some extent. But I do support your guiding principle of it's kind of all or nothing in terms of not carving out certain activities or certain things that may be left behind or maybe move forward. I think that kind of carving out would just lead to all kinds of confusion, but then all kinds of people saying, me too, as we already are hearing. I want to just switch gears a little bit, though, and look to the future. Our rates of vaccination are accelerating. We're vaccinating around 2% of the population a day for their second doses now. And if that were to continue through the whole month of July, and likely will, almost everybody who's going to want a second dose will have one by the end of July. So when does the planning start to actually, I know this is going to sound odd, but when does the planning start to actually start decommissioning the large vaccination clinics and then relying on primary care and pharmacies to go the rest of the way and carry on indefinitely, as we'll still have people who need vaccinations for one reason or another going forward. It's too soon to be doing that, obviously, but somewhere by the end of July, we might be in that position.
Dr. Wong, do you want to start?
Deputy Hilton, please feel free to give me a sign that you'd like to jump in. So yes, so both the province and ourselves have been thinking about this and continue to plan actually for this. We do know that the plan provincially is to transition out of mass clinics into delivery primarily through pharmacies and primary care practices, and hold clinics for special circumstances as needed. For example, to outreach difficult to reach populations that may need additional supports, even if there are, for example, pharmacies and practices in their area there may be some additional efforts that are needed there. So that's really the future model. So the plan is really to keep the mass clinics running for as long as we need that high volume output, because they're the most efficient in getting out large quantities per clinic. And so, it's something we actually continue to monitor. And I think Deputy Hilton, will provide updates as we progress about how we're planning to enable that transfer. We are also working to support these partners in a ramping up, because they have to be ramped up to a sufficient degree to allow us to ramp down so that there isn't a gap in service. And so, for example, the family practices, ourselves and our family practice partners that are taking leadership roles on the vaccine rollout are working really hard to try to set up more practices to be able to deliver vaccine. But it does take work, because it's not easy. They have to learn the new system. They have to. There's a lot of steps there. But once they're up and running, it should go faster, and they should require less support. I don't know if Deputy Hilton would like to add anything to that.
Deputy?
Thank you. What I would additionally add is we have to look at, obviously the demand is far greater than what we're able to provide appointments and at this time, but we'll have to start looking at when the appointments start reducing, and then look at the largest clinics. Is there capacity to now ramp down? So we'll just, much like what we saw in the ramp up, you'll start to see in the ramp down based on the need at the time. And then eventually, yes, slowly start closing some of those larger clinics with the redirection to pharmacy and primary care. There's great opportunity, as Dr. Wong had said, to ensure that our family health practices, particularly our smaller ones, are set to take on that role as well. And that work has been ongoing since the rollout of this plan. So I think we're well positioned. It's just a matter of keeping an eye on those appointments and the demand, and then we'll start to ramp down, much like it's much easier to ramp down than it is to ramp up, for sure.
For sure, yeah, of course. Thanks for that answer. Now, the other question I had is, again, kind of future looking, and Dr. Wong, on Friday night at the clinic in Pine Bush, my claim to fame that night was that I was the one directing people after they got vaccinated to where they had to sit. And my claim to fame was that I directed the medical officer of health and her husband, after she got her second shot, to where she had to sit. And I just felt I had tremendous power at that particular point in time. But we had a conversation that night, and I wanted to ask the question now, and it relates to something that somebody said earlier. And again, it's kind of future looking. What jurisdiction will it be? The feds, the province, the municipalities, or the local public health units, who will be determining on an ongoing basis the privileges or the lack of privileges for people who have been vaccinated or not vaccinated? So, for instance, on Friday night, we talked just very briefly about whether or not, and I don't want to get a big discussion going here, but whether or not the region would say you're going to be vaccinated to be on the GRT. We think the feds are probably going to say something along the lines that if you want to cross the border, you're going to have to be double vaccinated, any form of international travel. But I think what a lot of people are saying and they're frustrated with is that they have done everything. They have done the public health precautions. They've gotten both vaccinations, or they have an appointment for their second one. And they just feel like, well, what is there nothing in it? of course, they're protecting themselves. They know they're protecting themselves. They know they're protecting their family. They know they're doing the right thing. But there's a certain sense of frustration over that 10 or 15% of people who are not getting vaccinated and who are being somewhat selfish about it. And they don't seem to be suffering any consequences other than they're much more likely to catch Delta. And that'll be quite a consequence if that happens. So is there do you foresee, and I know that it's not going to be up to us or you, but do you think there will be a system later on? I know the province and the feds are looking at some kind of a universal vaccine passport, or call it whatever you will, that might be available, and people will be able to show that they've used it or they've been vaccinated for any particular privilege that might accrue. So I'm just kind of like, a year from now, where might we be in that regard? Do you have any crystal ball in that regard?
Those are great questions. It's very understandable. People would ask them, especially, I've gotten those questions, of course, about, well, I'm fully vaccinated. My family is. Why, can't we do the things that we should be able to do because we're not a risk to others? So I think for the first question, it would be at the federal and provincial levels that they would make those policy decisions. So things like vaccine passports would be at the federal level, of course, in consultation with the provinces. And we've seen the province make decisions, for example, on vaccination among long-term care staff. So primarily at the federal and provincial levels, they'll make those kinds of policy decisions, vaccination status, and what that may mean for certain things people will be able to do, like travel, or for certain sectors like the care sector. There's also private companies that can set policy, in terms of what they will encourage or require of certain employees based on the type of work that they would do. So that's also a possibility, and it's not really possible to know, what they will do, but it would not fall to the regional government generally to make those kinds of policy decisions. The thing about individual vaccination status versus restrictions on the community as a whole. We are seeing guidelines that have come out now from the federal government, and that will, I understand, come soon from the provincial government about what fully vaccinated people can do, right? And they will be, they do recommend that those people will do more, but their recommendation is always under the context of, if in your area those activities are recommended or permitted. So it's always subservient to the community-wide recommendations and level of restrictions that are in place, because yes, at one point we'll get to a point where we have enough vaccination where there will continue to be some cases and outbreaks, but it will be controlled well enough that we don't have to have those community-wide restrictions, and we can be much more open. That will happen in the future. And the consequence of that will be there will still be cases, outbreaks. There will still be little outbursts, sometimes some bigger ones, but it will be a different environment because overall we'll be much more protected as a region and not having to be under those restrictions anymore. So that's where we want to get to. And that's why, the path we're taking is really a path that's a little slower, but in the same direction, where we want to get those rates up the highest. So it's not that everyone will continue to be under restrictions for as long as, there are cases and outbreaks. It's until we achieve a level of control in the spread that we're not concerned about it deteriorating and rapidly growing to a point that we have to put in place more restrictive things and take a step back. So that's really why temporarily we're in this situation. But in the long term, there will be less and less restrictions, and then people that are fully vaccinated will be able to fully enjoy all the privileges that come with that.
Thank you, Councillor Galloway. Any further questions?
Well, that'll be it. Thanks.
Thank you. Okay, Councillor Erb.
Thank you, Madam Chair. And Councillor Galloway asked the question I was going to ask on restrictions, but I too want to, along with my other colleagues, say to Dr. Wong and to Deputy Chief Hilton our appreciation. Your response has always been calm and measured and reassuring to the community, and I think that's been so helpful. And so thank you, and to all of the people that are involved in the team. Just if I may follow up a bit though to what Councillor Galloway was asking. So I understand that the overarching direction for passports may come from the province or the feds. However, as a municipality, would we have the ability to say, you know, if you don't have 2 shots, you can't attend public meetings that are hosted by the region. You can't enter our facilities. You can't appear as a delegation in public at a regional council meeting if we ever get back. Like, do we have those capabilities as a municipality to send a signal to the community that we see this as part of dealing with this?
So, Councillor Erb, I'm just going to allow Mr. Lochner to jump in. I don't know if that's a public health issue as much as it is a municipal issue. So, Mr. Lochner?
Thanks to you, Madam Chair. Maybe both. If we could take that away, I understand why there may be a sense that that could have a certain outcome, but I'd want to understand the unintended outcomes. Sometimes when we take those kinds of approaches, they don't necessarily have the outcome that we think they might. So I think if we could take that away under advisement, Councillor Erb, I'd really appreciate the opportunity to take a further look. It certainly would want experts like public health to weigh in based on experience of how to influence the public on these kinds of matters.
Mm-hmm. And I wasn't expecting an answer today, but just wanting to see what that could lead to. I've taken the little receipt that I got from public health for my second dose, and I've laminated it, and it's in my wallet, so that if sometime I'm asked, I can prove it. And I do that with no feeling of discrimination or anything against me at all, but simply a way of protecting other people in our community. Thank you.
Thank you, Councillor Erb. Councillor Foxton.
Just as my understanding, once you're an elected official, you represent everyone, including those that don't vote for you, that didn't vote for you. We represent everyone. We can maybe, with permission of the province, they will have to decide this down the road, state that if you have not had your immunization shots, you will have to do a virtual instead of an in-person. But we have to allow the voice of the people to be heard, even if they don't have their shot.
Thank you, Councillor Foxton. So we'll look further into that. Colleagues, I see no speakers. We have no petitions, no delegations. The minutes of the previous meetings, they're items A through J, I think. Who would be prepared to move the minutes of previous meeting? Moved by Councillor Galloway, seconded by Councillor Jowett. Please use your yes and no icons to vote for the approval of the minutes. That is carried, colleagues. The next agenda item is communications. There was an electronically distributed information package. Any questions from council on that? Seeing none, I'll now entertain a motion to go into the committee of the whole. This is moved by Councillor Kiefer, seconded by Councillor Foxton. Please use your icons to vote to go into the committee of the whole to consider reports. That is carried. First up are finance reports. We can have one motion to accept all of the finance reports unless somebody wants any of them taken separately, and these are reports A through I. Could I have a motion move, Councillor Jowett? You're moving them?
No, Chair Redmond, I think I need to take the letter D because unless you want me to abstain from all of the items that are enacted by the bylaws first, second, and third reading.
We're not there yet. Unless you have a conflict with plow trucks.
Right, no.
Okay.
Well, I'd like one.
Okay, but would you like to move the motion for all the finance reports? Okay, moved by Councillor Jowett, seconded by Councillor Armstrong. Please use your icons to vote yes and no. That is carried, colleagues. Flipping pages really quickly here. I want to make sure that I'm not missing anything. We now will have a vote to approve summary of the Audit Committee, June 14th. There is a recommendation included in this. If I could have a mover and a seconder. Moved by Councillor Erb, seconded by Councillor Clark. This is approving KPMG to continue to be our auditor. Please use your icons to vote yes and no. That is carried. We now will have a vote to approve the summary of the Committee of the Whole of June 22nd, 2021. Items 12 and 19 will be taken separately, colleagues, because those are ones that people have conflicts on. So would somebody like to remove the rest of the balance of the items? Okay, they are moved by Councillor Jowett. Councillor Erb, please vote on all of the items except 12 and 19. That is carried, colleagues. Item 12. That's Councillor Shantz and Councillor Harris have conflicts. That is moved by Councillor Galloway, seconded by Councillor Erb. Please use your icons to vote yes and no. Councillor Foxon, do you have a question or are you voting with your hand? You're on mute, Sue.
Page 57. Have we got to page 57 yet? The committees, the committee, ad hoc committee terms of reference. It's just a typing error I want to point out. So, but have we passed that in our grouping?
We have not got there yet, but when we get to page 57, do you want to do the correction now, Sue? Is it substantive?
No, it's very minor. It's just a typo type thing. So it said page 57, item 4, bracket D. It says should the and inefficient. I think so. It should say should there be an insufficient.
Thank you. We duly note that. Thank you, Sue. I thought you had a background in recreation, not being teacher, but grammar check is always welcome. Thank you. So now we're voting on item 19. This is the one that Councillor Jowett has a conflict with, although we do all know that we can buy her a snowplow for Christmas. That is moved by Councillor Galloway, seconded by Councillor Kiefer. Please use your icons to vote. That is carried. We'll now vote to approve the recommendations related to the new affordable rental housing. This is item 12 from the summary of the Committee of the Whole from June 22nd. Oh, no, sorry, we did that already. So now we're on the ad hoc committee reports. Okay, I think this is one where Sue was giving us a, pointing out the typo. So this is the Ad Hoc Committee Community Benefits Terms of Reference. Could I have a mover for that? Moved by Councillor Armstrong, seconded by Councillor Foxton with the amendment and the typo fixed. All those in favor, please vote. Thank you, colleagues. That is carried. The next item is the closed council committee on June 30th. And there are actually two recommendations. One about approve and enter into an agreement of purchase with a numbered company. And the second one is the one that we dealt with earlier. The regional council directs staff. Oh, different. Okay, we're just going to do on the one right now. So could I have a mover and a seconder for that? Moved by Councillor McGarry, seconded by Councillor Foxton. All those in favor? That is carried. And now it's the summary of the committee of the whole, which was the recommendation I was trying to read. And this is where we directed staff to develop a preliminary 2020-22 budget within the range of 2 to 3%. Could I have a mover for that? Moved by Councillor Clark, seconded by Councillor Schatz. Please use your icons to vote. That is carried, colleagues. A report from the Chief Administrative Officer. None. I have no report. Regional Clerk. Heritage appointments. Do you want to speak to these, or we're just, okay. So there is a recommendation about appointments to the Heritage, Waterloo Regional Heritage Foundation. David Emberley, Lindsay Haggerty, and Jane Holland. And that is moved by Councillor Clark. Seconded by Councillor Jowett. All those in favor, please use your icons. That is carried. Under matters under the Committee of the Whole is the conveyance of road dedication in favor of the City of Waterloo. It's 350 Conservation Drive. Could I have a mover for that? Moved by Councillor Armstrong, seconded by Councillor Erb. Please use your buttons to vote. That is carried. I now entertain a motion for the Committee of the Whole to rise and Council to resume. That is moved by Councillor Kiefer, seconded by Councillor Schatz. Please use your icons to vote. That is carried. I'll now entertain a motion to adopt the proceedings of the Committee of the Whole. Could I have a mover to Councillor Jowett, Councillor Galloway? Thank you. All those in favor, or please vote using your icons. I guess you could vote against it if you wanted to. That is carried. We have no motions, no notices of motions, unfinished business, other business. Councillor Vrbanovic.
Thanks, Chair Redmond. And I just wanted to check in with staff on one issue. I know the St. Mark's shelter in Kitchener is going to be closing today. We extended it by a few months, but it's part of the Indwell construction project that recently got approved by Council. And I'm just wondering if we can hear from Mr. Bartholomew Saunders what the transition plans are, because I just want to make sure that those residents are being looked after and will have alternate accommodations after tonight, until obviously we can work with them to hopefully find longer-term housing.
Thank you, Councillor Vrbanovic. I see Mr. Bartholomew Saunders, and I also see Dr. Wong. So, Mr. Bartholomew Saunders, do you want to start?
Yes, thank you. Through you, Madam Chair. Both the House of Friendship and the Bridges have beds that are available, and notwithstanding the outbreaks that are in both, they can continue to receive intakes. The process is slightly different in that it mirrors you in Sunnyside Home during an intake or during an outbreak. Intakes are required to be isolated for a period of time, and I believe it's 14 days, although I can't say for certain that that's the number of days. Ryan Pettipier is in the meeting as well. He might be able to confirm that after Dr. Wong speaks to the issue. Dr. Wong, did you want to add?
No, just to support what you said, that we're working with the shelters so that they could admit in a safe way.
Thank you. Mr. Pettipier, I saw you flash on and off. Do you want to add any detail to that answer? Or?
No, through you, Madam Chair. I think Douglas and Dr. Wong have addressed it.
Thank you. Councillor Vrbanovic, any further questions?
So just on that, and that's the most important thing to hear, is that we have a process in place. I gather because these folks arrive and leave every day, it would mean that they're isolated in terms of those 14 days, but they still come and go, or like how I'm just trying to understand how that would work, which is different than, at Sunnyside or any long-term care facility in the community.
I'd have to leave that to Mr. Pettipier. I don't have day-to-day operations.
Mr. Pettipier?
Thanks for the question, Councillor, and through you, Madam Chair. It's different depending on the site and the public health guidelines. So for individuals that are demonstrating symptomatic or have been in close contact, they're directed to our specific isolation spaces and supported by shelter staff to remain there. New intakes to the shelter system, and with our help, with the help of our colleagues in public health, we're arranging different cohorting mechanisms to ensure that they're separate from others that have remained at a specific site. So there are various and tiered measures to allow new intakes to happen, and depending where you have stayed previously or if you're symptomatic, there are measures in place to ensure continued safety and that we can continue to take new intakes at our shelter system with the closure of St. Mark's.
Okay. Do we know how many people roughly we're talking about that are going to have to move after tonight?
Mr. Pettipier?
Thank you again, Councillor, and through you, Madam Chair. As of last night, we were down to approximately 32 individuals that access the space. And I can assure you through our community partners at the YWCA, Underwood, Sanguine, and many others, the closure and working on alternative accommodations for this group has been ongoing for a month. So that's is the current number, and that those occupants are aware of the options that are available to them, including how to access transportation to the shelters as they exist.
Okay, so there will be a spot for everyone, is what I'm hearing, in one of the shelters. There's just precautions in place to deal with it from a health safety point of view, and we're encouraging to ensure that we don't find these people's out on the street or elsewhere as much as we can. Is that correct?
Mr. Pettipier?
Yeah. Oh. Go ahead, Ron.
Thanks, Douglas, and through you, Madam Chair. That's correct, Councillor. We are providing options, encouraging people to take them, and providing the transportation. There is space within the shelter system to accommodate those individuals. If they're choosing not to accept those, then there are connections through our existing drop-in centers and our outreach workers that can connect with them and provide further encouragement and connection to other options and supports that they may need. So yes, your assessment and summation of the situation would be correct with those additions.
Okay, so all I'll ask is that we can really, try to stay on top of this, because, I anecdotally am hearing there are some pressure points around, and so we can just stay on top of it. It would be appreciated, and I'll follow up directly if there's any issues. Thank you.
Thank you, Councillor. Councillor Erb, is your intervention about this issue too? Because Councillor Harris has another piece of business. Is it about this issue? Because go ahead if it is.
And if I just may, thanks for Councillor Vrbanovic for raising that. And we had a fulsome discussion on that this morning at the Housing Committee meeting, and Mr. McAvoy explained in detail what backup measures they put in place. And I think we felt reassured based on what he was telling us and what we've heard from Mr. Bartholomew Saunders and Mr. Petier, that those folks are going to be well cared for.
Thank you for that, Councillor Erb. Councillor Harris, go ahead.
Yes, thank you, Chair Rubin. I would like to make an inquiry of staff. I've been getting significant correspondence from folks out in the Blair area, South Kitchener, with regards to the Blair development. I know that it was before the city council there. There's currently an MZO application before the province. I'm wondering if staff, not now, but perhaps whenever they can, provide some sort of small report as to the region's involvement in the approval of this development, etc. I know that there's some road work, etc., and any other involvement that the region has in approving this project. Is that something I can place on the council inquiry list?
Yes, you can, and it's duly noted. So it'll be yes, it'll come back, right? I imagine you'd like it maybe in the next cycle. Oh, Mr. Regier is on. Go ahead.
Yeah, definitely as soon as possible.
Yeah, yes, certainly. We can come back to council, Chair Redmond, with some additional information about that project. The region has minimal involvement from a planning point of view, because most of the land had already been zoned appropriately for industrial uses, and really it's a local planning matter at this point, with the ministerial zoning order in the works right now.
Thank you. Does that answer your question, Councillor Harris?
Yep, thanks. Any report though would still be appreciated, please.
Okay, my only caution would be we're not meeting until August, so if you'd like it as soon as possible, are you okay if it's the form of an email maybe that goes out to all of council?
Sure. Yes.
Okay. Thank you. Councillor McGarry.
Thank you. I was just going to speak briefly to that. The MZO was approved by council and by Cambridge Council, and a subsequent reconsideration failed. So at the moment, the status of the MZO is that it's in front of the minister, and that there's no further involvement from a local planning matter. I know that this is a very engaged group of citizens who continue to engage not only Cambridge Council residents, but regional residents. There's really, we've met as local Cambridge Council as well as the regional council members with staff, and there's really nothing to report at this particular point. It really is a matter in front of the minister, and currently the proponent who has permission to go ahead and grade the land that they do own and is zoned M1 already is perfectly acceptable for them to go ahead with. So I would also note that there is a lot of misinformation coming from this group of residents, and they continue to engage our local, really our local press and a number of different things, but there's a lot of incorrect information in what they're sending. So I'll also look forward to the report that regional staff will provide. Thank you.
Thank you very much. So, colleagues, this is pretty momentous meeting for some of our staff. And I just want to acknowledge that it is the last council meeting for our solicitor, Deb Arnold, as well as our clerk, Chris Fletcher. And yes, Chris tried to retire a few months ago and it didn't take, so she stayed on. So we're eternally grateful for her continuing to help keep us on track. It is also the last council meeting for Michelle Sergi, who is just a crackerjack in our planning department, and we wish her the very best as she moves on to the region of Niagara. And Matthew Sutcliffe, and I don't know if Matthew is here, and Matthew is our amazing negotiator in our HR department, and make sure that we continue to be a fair employer to all of our employees. So we, I guess, bid congratulations to Deborah and Chris on their retirement. And it sounds like from their retirement conversations that you'll find them on the golf course, or one of them will go for a beer and not actually end up on the golf course. And to Michelle and Matthew, every success. These other municipalities are lucky to have you. And so thank you for all the work you've done on behalf of the 630,000 residents of Waterloo Region, and we wish you all well in the next chapter. And now, I would entertain a motion to enact bylaws, first, second, and third readings. Could I have a mover and a seconder? Moved by the birthday boy himself, Dave Jaworski, and seconded by Councillor McGarry. Would you please use your icons to vote? That is carried. And I've run out of paper, so now we need a motion to adjourn. Moved by Councillor Vrbanovic, seconded by Councillor Shantz. Please use your icons. However you spend Canada Day, I hope you all stay safe, and we will see you all soon. Maybe even in person and not just virtually. So thank you all for all you do.
As always, safe drive home, everybody.